KidConfident, thank you very much for joining me for this short tutorial presentation from the American College of Surgeons Stop the Bleed campaign. And we're here to take you through the steps of managing catastrophic hemorrhage in children. This presentation augments the trauma skills that you've already learned during your training for managing catastrophic bleeding in adults, and like all KidConfident content, is designed to make you feel more confident managing this in children. So Stop the Bleed was an initiative brought together by the White House in response to shootings in the USA, which brought together many major organisations, including the ones listed here, to work on a collaborative effort to educate the public on bleeding control. At KidConfident, we have worked with Stop the Bleed to bring you this version of their course to help build your confidence as ambulance clinicians to manage bleeding in children. Some of the images that are shown during this presentation may be disturbing, and while we've done our best to try and limit the graphic content, some of it is obviously unavoidable. So why do people need this training? The number one cause of preventable death after injury, as you know, is bleeding. And as you also know, there are some very simple steps that can help us recognise life-threatening bleeding, intervene and potentially save a life. Now, in the USA, they have some different problems to the UK, but they're not exclusive to the States, and we do experience the same incidents here in the UK, although thankfully much less frequently. School shootings and mass casualty or terrorist incidents are examples of places you are likely to need these skills, but you can encounter life-threatening bleeding in many other situations too, such as road traffic accidents or kitchen injuries. Other areas where you can find these injuries could be from children playing in construction sites, garages or workshops where curiosity surrounding power tools may overcome sense. While major incidents and terrorist activity receive a lot of attention, serious bleeding is more likely to result from everyday injuries at home or while on the road. So the steps that we're going to look at today are going to be: number one, identifying what life-threatening bleeding looks like, and then number two, implementing the steps of Stop the Bleed by applying pressure, packing wounds and using tourniquets as the main interventions used to stop life-threatening hemorrhage. As with all pre-hospital jobs, the very first thing we need to remember is that your safety is first. If you become injured, you won't be able to potentially help others, and there are situations that you might encounter where you could be the only person who's confident enough to apply these skills for paediatric patients. It sounds obvious, but children generate so much emotion compared to adult patients, and it is really easy to get sucked in and forget to keep yourself safe. Always assess the scene to decide whether or not it's safe for you to intervene, and remember that situations can evolve, and even if it was safe at first, things change, and if it becomes unsafe, please stop, reassess the situation, move to safety, and if you can, and it's not going to put you or others at risk, take the patient with you. Part of safety is protection from the exposure to blood and blood-borne viruses, so while this risk is extremely low, you want to be able to protect yourself. So please remember to put your gloves on, and if you get blood in your eyes, mouth or over broken skin, then please follow your trust's occupational health procedures for dealing with this. So we're all familiar with the ABC approach to emergencies, so we'll use this structure as a way to help us remember how to manage catastrophic bleeding. Step A is going to be alert. B is the assessment of bleeding to decide whether it's life-threatening or not, and step C is compression, or the application of the Stop the Bleed skills. The first step is going to be alert, and this is alerting control that you have a paediatric patient with a catastrophic hemorrhage. It might not seem like a priority or overly important, but you're soon going to have your bandwidth sapped by the scene and by the patient. An open channel modified eFame message is perfect to save time, pass enough information and allow the teams in control to make sure you've got enough clinical support moving towards you. This might be a paramedic or a specialist paramedic if you're part of a double tech crew, or it might be critical care support from HEMS or basics. If you're a single responder on scene, control need to know that you need more hands and an ambulance to get your patient to definitive care. So definitely do this first before you start to intervene. It will save a lot of time. Most HEMS critical care teams carry blood too, and this may be needed if and when the patient suddenly decompensates. it's more of a risk in children. So make sure you ask early. I would definitely rather be stood down from this sort of incident than arrive too late. Describe the scene, including the exact location of the patient, for example in a specific classroom or in a shed, garage, or whether or not the scene is safe. If it's not safe, then identify the hazards and any info that will help get other teams to the scene. Say how many patients there are if there's more than one, and what help you need to need. This might include the police to secure threats, critical care for blood or fire and rescue or heart teams to allow you to get to the patient or get them out of any predicaments that they're in. So the next step will be assessing the bleeding and trying to decide whether or not this is something that's life-threatening. If you look at the image here, you can see that someone who has a pretty large wound on their leg, and you can see that there's a large amount of blood there. So clearly this is something that could potentially be life-threatening. Remember, children are small adults, and because they're smaller, they've got less blood inside them in the first place. So have a lower threshold for what a lot of bleeding looks like in children. You'll want to move on to the steps of stop the bleed. So again, number one, you want to find the source. You want to expose the area, which may mean that you have to remove some clothes in that area so that you can get a really good look at the wound. And then you want to look for signs of potential life-threatening bleeding. So you want to look things like continuous, pulsatile or spurting blood, large volumes of blood or blood pooling around the area. This isn't an exhaustive list, but all of these could be signs that the patient could be bleeding to death, even if they look okay at the moment. There could also be multiple sites of injury and the patient could be bleeding from all of them or any of them. Remember that clothing can hide injuries, so you really need to fully expose your patient and look for all the sources. If we divide the areas where a patient can bleed from into zones, we can see from these pictures that there's 3 main zones that catastrophic hemorrhage can occur from. The first area shown in blue is the legs and arms, or the extremities, and these are areas where you can use all of the methods of compression, including packing, direct pressure or tourniquets. The second zone in green, where you have the neck, armpits and groin, are called junctional areas, and these areas you can't really fit a tourniquet around them. I would highly recommend you don't apply a tourniquet around the neck, but you would be able to put direct pressure or pack wounds in these areas. The third region is the torso, or the main portion of the body. Now, if you can just imagine, there's no amount of pressure or compression that you can really apply in these areas that will really stop internal bleeding, and you might not have any clue about whether there is any internal bleeding happening anyway. You can't apply a tourniquet around the whole torso, and these are the people who are going to end up needing rapid transport to hospital for further care, or they may need some interventions such as a thoracotomy by critical care teams so they can be stabilised before transport. So let's just summarise this slide. The blue zones, the extremities, arms and legs, you can use direct pressure, packing and tourniquets. The green zones or junctional areas like the neck, armpits or groin, direct pressure or packing can be used. And the red zone can be packed and even needs critical care interventions or rapid transport, preferably to an NTC, but you may need to run to a trauma unit with paediatric facilities if the patient is really unstable. Injuries to these areas reinforce the importance of the alert steps so that advanced care teams can be deployed to help quickly. It's probably also worth mentioning scalp or head wounds briefly here too, because they can bleed a lot, but like junctional areas you can't really apply a tourniquet. Direct pressure is the way forward here. So now let's have a look at step C. To revise the skills you've already learned for control of catastrophic hemorrhage in adults. Simply put, to control bleeding, we're going to compress by applying pressure. This is going to stop the majority of bleeding, so it's a good starting point. And from there we can use a gauze or a trauma bandage, pressure dressing, or even just some cloth-like material. Use just enough to cover the wound, as excessive amounts can actually reduce the amount of pressure applied and make the intervention less effective. If gauze or trauma dressings aren't immediately available, use any clean material such as a t-shirt and apply direct pressure to the bleeding site. The application of pressure may require a significant amount of force, and this might hurt a lot. and that's to be expected. So just make sure you explain this to the patient and any bystanders as you're doing it. Reassure them that you will provide some analgesia once you have control of the life-threatening problem of catastrophic bleeding. Apply enough force to stop the bleeding and secure dressing to maintain this level of pressure. Let's revise the skills you need for applying pressure to a bleeding wound. Here you'll see the application of pinpoint pressure directly onto the site of bleeding. This is an effective method of controlling bleeding. The demonstration in this video is in slow time to show the process, but in reality we will need to act fast to control bleeding. So once the person in the video identifies the bleeding, she grabs a t-shirt as she doesn't have a haemorrhage control or a Tourniquet available. Direct forceful pressure is applied over the wound and this will cause pain. Reassure, but do not stop. Remember that acting fast and not letting up on the pressure are the keys to success. If bleeding is from a deep wound or a cavity, superficial pressure may not work and you need to pack the wound deeply and tightly. Hemostatic gauze like Celox is perfect for this, as it will also help form a clot, but be careful as there may be sharp objects or fragments of bone within the cavity. Once the bleeding stops, do not check the wound. Just dress it with a trauma or blast bandage to apply pressure over the packing. As before, a demonstration in this next video will be in slow time, but that's just to show the process. Remember, fast action is required to control major bleeding. So here the clinician has some hemostatic gauze. She's getting it out of the packet and then identifying and exposing the injury. She then packs the gauze ribbon deeply into the wound and then she's going to apply direct pressure over the injury. Blast bandages found in most trauma packs on UK ambulances are ideal for this, and the process of wound packing and forceful pressure, remember, will cause pain to the patient, but reassure them and don't let up or stop. You'd rather give them some analgesia later than let them bleed to death. So packing as a way to control bleeding is really useful in many different areas, including the extremities, junctional areas such as the neck, armpits and groin, and for penetrating injuries to the chest and abdomen. The bleeding will be occurring internally and these patients will need to be taken quickly to a major trauma centre where the bleeding can be stopped. Tourniquets should be considered for extremity bleeding that doesn't stop with pressure or packing, or if the situation does not allow you to maintain pressure on the wound. Following these simple rules will help maximise the effectiveness of tourniquets. So apply it 2 or 3 inches above the wound, or really as close to the wound as possible. Do not place it over an elbow or a knee joint. It can't apply enough pressure to blood vessels to stop the bleeding. Tighten the tourniquet until the bleeding stops, and never remove a tourniquet unless you have a means to definitively control the bleeding, and that usually means you're in an operating theatre. You can apply a tourniquet to others or even on yourself if needed, and they can be applied over light clothing if you need to be really quick, but bulky clothing such as jackets definitely need to be removed for the tourniquet to be effective. Placing a tourniquet is really painful for the patient, especially as they're already experiencing severe pain as a result of their injuries, probably. Expect this, warn them and reassure the patient and the bystanders, but don't stop and don't ever loosen an effective tourniquet. Sometimes you may need 2 tourniquets to achieve control, and this is routine in operating theatres, so don't be afraid to use 2 if you need. So we've got another demonstration. In this video, again, will be in slow time for demonstration purposes, but remember that in real life, fast action is needed to control bleeding. Here, our clinician will apply a combat application tourniquet or a CAT tourniquet to the upper extremity of the patient. These are the most common tourniquets found in UK trauma ambulance service trauma packs. Take it, open up the Velcro band, place it above the injury, pass the strap through the buckle and pass the band around the entire arm. This pulling it tight removes all the slack, and it's really important to wrap the Velcro band all the way around to prevent it from coming undone. Once it's fully wrapped, then tighten the windlass rod until the bleeding stops and then secure it in the clip. The remainder of the band is then wrapped, the strap is secured, and the time is marked. Like I said, this is a painful procedure, but pain does not mean that we should reduce the effectiveness of the intervention by loosening the tourniquet and allowing bleeding to continue. Remember, the goal is to stop bleeding. So there's several variations of tourniquet which are commercially available, and these two are the tourniquets that are found on UK ambulances and also happen to be approved by the Stop the Bleed Committee. You may see either of these tourniquets in your service and should become familiar with them and how they work. The principles are the same, but the clips are slightly different. Improvised tourniquets are difficult to make and apply correctly and may in fact increase the bleeding by compressing venous structures. They have not been scientifically tested and therefore their use is not recommended. More information about all the different types of approved tourniquets is available at the Stop the Bleed website. So as you're all used to hearing from me, in the context of major trauma, children are small adults, but there are some extra pearls of wisdom for controlling bleeding in children. Tourniquets are indicated in children just the same as in adults. As long as they can be properly applied, the same tourniquets can be used in an adult or a child, so there's no need for any special equipment. If the child is too small for the tourniquet to be applied properly, direct pressure on the bleeding wound will almost always work to control bleeding. Wound packing is exactly the same for both adults and children. You'll just probably use a bit less gauze. So as you can see, the principles for managing catastrophic hemorrhage in children is exactly what you've learned for adults, and you already have the skills to achieve it. The hardest part is the emotional control and composure to take a breath and put in an alert call to control so that extra resources can be organised to help you if needed. Children's MTCs aren't always co-located with adult MTCs either, so having some support for longer transfers might be a nice thing. You can check the Children's MTC map on KidConfident.org to see where they all are in the UK and refresh your memory. So there's a few other questions that are commonly asked around this subject. What should be done with impaled objects? Well, they should be left in place, not removed. You can apply a tourniquet above the object if needed. Ideally, they need to be removed in theatre under direct vision and the wound thoroughly cleaned while bleeding is definitively controlled. Improvised tourniquets, as we've already discussed, are difficult to make and often don't really work effectively, so use a service issue tourniquet as a rule. Loss of an arm or leg is referring to the fear that tourniquets can cause ischemic damage if left on for too long and could result in the patient losing their arm or leg. You need to remember that when placing a tourniquet, you're doing it for catastrophic bleeding and to save the patient's life. This far outweighs the risk of losing an extremity. And putting it bluntly, for the worst case scenario, be alive with a partial amputation or die with all your limbs intact. This is also why it's important to put the time of application on the tourniquet to act as a reminder to everyone about how long it's been on. We would routinely leave them on for 90 minutes to 2 hours in theatre, so it shouldn't be a pre-hospital concern. Pain. Well, patients will experience pain with direct pressure, wound packing and tourniquet application if they're done properly. It's important to manage the expectations regarding all three of these techniques for controlling bleeding, reassure and provide analgesia once life-threatening issues have been managed. The Stop the Bleed website has a wealth of information and addresses other questions people commonly ask, so it's well worth a look. So let's summarise everything we've gone through today. These are the basic principles that should govern your response to the big C, or catastrophic bleeding in children. The same principles also apply to adults, and you won't go wrong following this plan in patients of any age. So first, make sure the scene is safe. Then step A, alert, pass a message to control to inform them of a patient with catastrophic bleeding. Using the ethane structure is ideal and gives control the information they need to get extra resources to you if needed. Bleeding, look for bleeding and decide if it's life-threatening. And make sure you expose the patient fully and find all the sources of bleeding. Then C is to compress. Once you've located the source, controlling the bleeding will involve application of direct pressure, packing of the wound, application of a tourniquet, or possibly even a combination of all three of these techniques. The goal of this program was to recognise life-threatening bleeding in children and to take appropriate steps to control it so you can get the patient to definitive care. You already know how to do this from your training, but it's probably only ever been directed towards adults. Children are small adults in the context of major trauma. And remembering this and following the Stop the Bleed stepwise approach to catastrophic hemorrhage will hopefully give you the confidence to save children's lives if they have major bleeding from traumatic injuries. For more information, visit stopthebleed.org. This site is maintained by the American College of Surgeons and is updated frequently with new information regarding this important topic. In addition, the KidConfident.org website has educational posters, clinical tools and other learning resources to help you be kid confident managing sick children. Check it out if you haven't already and sign up to our newsletter to receive the latest updates and resources every couple of weeks. Remember, the only thing more tragic than a death is a death that could have been prevented. Thank you so much for watching the KidConfident and American College of Surgeons Committee on Trauma Stop the Bleed presentation. If you are interested in a hands-on skills training session which includes direct pressure, wound packing and tourniquet application, then leave your details below this presentation on the KidConfident website. If enough of you want a skills session, we will organise one in your area. Thank you so much again for taking the time to watch this video and please stay safe.